My name's Omar Mian. I'm a radiation oncologist at the Cleveland Clinic. I have a lab where we study prostate cancer and bladder cancer biology. There's been a lot of movement in the post-prostatectomy space. For some time now at my institution and others, we have been progressively moving towards early salvage radiotherapy and away from adjuvant radiotherapy. I believe there are still some men who will benefit from postoperative radiation in the adjuvant setting, that is an undetectable PSA, the highest of high-risk men. But we now know, and emerging randomized data supports this idea, that many men can be safely observed with ultrasensitive PSAs until the point that a PSA becomes detectable and they can then be treated. The Decipher test comes in this context, and we have to determine how this will add to our, again, clinical pathologic features, patient's history, PSA kinetics. The Decipher test still winds up being useful in certain cases. For example, in the highest of high-risk men who we think adjuvant therapy may be beneficial, a Decipher test may be a tiebreaker for us in who should or shouldn't get immediate postoperative radiotherapy. In men who have a PSA recurrence, who have otherwise low-risk disease, many of those men, we want to de-escalate therapy. A man who has a PSA recurrence many years after their radical prostatectomy with very indolent PSA kinetics, a very low absolute PSA, the Decipher becomes another tool if they're Decipher low risk to say, well, we can observe you. Your chance of dying of prostate cancer or developing metastatic prostate cancer, as quantified by the Decipher test, tells us that you may not benefit from immediate salvage radiotherapy. Both as a tool to escalate therapy in men who harbor potentially lethal prostate cancer, in men who have aggressive recurrent prostate cancer, Decipher is useful, but also as a tool to de-escalate therapy in men who have indolent disease, but a detectable PSA after prostatectomy. We know the Decipher can help us identify those men in whom survival or metastasis benefit, a true meaningful benefit in terms of prostate cancer outcomes, may be gained by adding additional therapy.